meeting, so that'll begin in about 10-15 seconds, all right?
Morning all, we're about a minute or so past 10. Did you want to get a cup of tea, Chris, and then we'll make a start? Welcome to the November Health and Wellbeing Board meeting held on Scilly. Thank you very much. We'll do introductions in just a moment, but could I first have declarations of interest as agenda item 1, please? Councillor Grottick.
Thank you. I represent the local authority on the Cornwall Partnership Trust, Chairman.
Thank you very much. Any other declarations of interest, either here or remotely?
No.
Okay. Would it now be possible to do introductions for both here on St Mary's and also around Cornwall? I'm Councillor Joel Williams, Chair of the Health and Wellbeing Board.
I'm Aisling Khan, DCS and DAS of the Council of the Isles of Scilly.
Robert Francis, Chairman of the Council of the Isles of Scilly.
Dr Pickinley, GP for Scilly.
Scott Fuller, Senior Officer for Adult Social Care on the Isles of Scilly.
Ian McCarthy-Lunn, I'm Health Watch Coordinator for the Isles of Scilly.
Paul Charnock, Chair, Health Watch, Isles of Scilly.
Fran Grottick, Vice Chair of the Council of the Isles of Scilly.
Nicola Stinson, Senior Manager, Strategic Development, Council of the Isles of Scilly.
And colleagues on the mainland joining the meeting, could you perhaps introduce yourself, please?
Okay, just start in St Austell, it's Jackie Pendleton, Chief Officer for the CCG. Rachel Murray, County Development Manager for the CCG.
Tim Francis, Head of Adult Mental Health and Disability Joint Strategic Commissioning for the CCG.
Can I just say, we've also got Caroline Ford. She's dropped her bag, but not to come back into the room, so she will reappear.
Okay, thank you.
Rebecca Cohen from Public Health.
Thank you very much. And I think it's just worth noting, anyone who joined our previous meeting, how poor the acoustics and audio was. It's a vast improvement. We can hear you loud and clear today, and hopefully that's been reciprocated with you at your end. Thank you very much. Item 2 is minutes of previous meeting. Held on the 10th of July 2018. Councillor Grottick.
Thank you. I've mentioned to the Administration Office that it might be a good idea if we actually just note that the members in attendance were actually attending via Skype for clarity.
Mm-hmm. Any other matters which anyone would like to pick up from the minutes of the meeting previously? In that case, are we happy to confirm them as a true and accurate record of our discussions? Thank you very much. I have no other objections. I think we can consider that passed. If I may, I just wanted to tinker with the agenda of our meeting slightly. I've got one urgent item which Nicola Stinson is going to introduce, which is hopefully going to set the tone for some good conversations. And I think we're moving the JSNA paper to the item after that. Is that correct? So we'll take that as item 4. So urgent item 3 will be Nicola giving an overview of some funding which has been secured by the council here. Thank you.
Thanks, Chairman. So I am the bearer of good news, I hope. We recently put in an application for some Sports England or lottery funding for the Families Fund, which is to target those families that are relatively inactive on the islands, both on St Mary's and the off islands. We have word back and a funding agreement from Sports England for just under £200,000 of funding over the next 3 years. And the intention around that proposal is to look at around activities that families currently undertake and how to get those who aren't sporty, if you like, back into activity. So I think a lot of this is going to be around a cultural shift. So what we do know on Scilly is that people who are sporty are very sporty and they get on with it. What we don't have is that connection with those families that are less active. So the idea of this fund is to create opportunities and to unlock the barriers to activities for families. And we're targeting 100 families over the next 3 years to help them get back into activities. And we don't want to scare people. So it's not about joining a gym class necessarily. I think it's about people being given opportunities to do things that they wouldn't otherwise do without some encouragement. So be that encouragement through funding or through opportunity. So the parent carers have come up with a number of ideas that fed into the bid. They include things like den building and bushcraft, geocaching, Wii games, so using dance and Zumba, all sorts of activities that don't necessarily come under the sporting headline to help those families get back into a more active lifestyle. So we're looking to be reducing barriers by reducing the cost of those activities by subsidising them through this funding, but also subsidising boating so that people on the off islands can access those activities on St Mary's. But importantly, kick-starting activities on the off islands too, and using some of the funding here to get volunteers to start getting trained up to provide activities beyond the funding period. So the idea is that we've got these what are called activators that will help us provide facility opportunities into the future. And the idea here is to link the work of the school, the council, the health sector, as well as people like the Wildlife Trust together to create those opportunities and find a way forward and get more people active on the island. So it's a good news story. Susie Taylor will be heading the project from our Active Silly team, and we will be providing a contribution in kind from the council to this. So it's almost fully funded. 88% of the funding comes from Sports England. The rest will come from small contributions from those users and in-kind contributions from the council. Thank you.
Thank you very much. As I sort of alluded to, I hope this sort of positive activity sort of flows through some of the other agenda items we've got. Certainly things like One Vision and Healthy Weight Strategy it's very relevant to. But I wonder if any other colleagues have any queries or questions for Nicola. Councillor Grottick.
I'd just like to say well done, because I know that the funding time frame was extremely tight and everybody pulled together very well to make sure we got the funds. So well done. And I'm really pleased that it's going to include looking at off-island participation, because so often they get left out. So well done, everyone.
Chair, could I just check that, is this for developing new approaches to activities, interests, etc. What about established groups such as, I mean, off the top of my head, sailing, rugby, judo, and other activities taking place at the moment?
So this is targeted at additional activities. So it could be that the judo club, for instance, wanted to extend activities to reach those harder to reach groups. So at the moment, it's not about those people who are already active. They're already doing it. This is about trying to get more people into organised sport eventually, but the first step might just be going for a walk, going for a cycle, giving people the confidence, using those activators to talk to families about what the barrier is. Is it self-image? Is it a behavioural change that's needed? Is there something else that we need to unlock? And everybody's story will be different. So the activators will be working one-to-one with families to find out what the issues are in terms of getting into activities. But it's not focused on funding for the established sports. It's focused on funding for families to access activities, whichever they may be, that suit that particular family.
Chairman of Council.
Thank you, Chairman. I just wanted to reiterate Councillor Grottick's praise that Nicola managed to get this through. I think it's excellent news, and I just wanted to echo that. While I'm speaking though, Chairman, could I just, before you get on to the main agenda items, could I just make a point about the minutes? In as much as we don't seem to have a mechanism for dealing with items that were raised in the minutes previously. For example, I asked about the training for X-ray last time and so on, and I'm just wondering how this is picked up and how it's dealt with, and whether we can get any feedback following meetings as to what action might have happened from the preceding meeting. If I could just ask that's looked at some stage how we can get updated on the points that people have made from the previous meetings.
Absolutely.
Thank you.
I'm totally aware of that. I'm involved in things like the Allotment Association, and even at that we have matters arise, and it seems a big omission that the likes of council and boards like this don't have the opportunity to challenge on progress and activities and activity since the previous meeting.
Chair, if I may, one of the reasons for that is if someone wanted to purposefully come here to listen to a debate about x-rays, they wouldn't know that was happening unless it was on the agenda. That's the classic reason for it.
Chairman, actually, we did always used to have actions arising as a standing item. So I think it's just to get back into that discipline, because then you follow up from the last conversation. We could do that.
Absolutely. Yeah, I think it would be great to have that action since last meeting. It does seem to disappear over time, but if we can make that an action for the next meeting. In the first place. Probably was, yeah. A very good one it was too. Yeah.
Would it be a prudent opportunity for me to intervene on the X-ray issue?
Can we do that as part of the Better Care Fund paper, please?
Absolutely fine.
So if we use that mechanism to perhaps update on X-rays later in the meeting. Yeah, I'll just echo all the comments about what Nicola was talking about. There seem to be some really exciting outcomes, and I hope we can perhaps feed that into Children's Trust Board, which is later this afternoon. And hopefully we've got some levers which we can pull to bring those people into the fray. Thank you very much. So I think we were now going to move item 6 to item 4, which is our Joint Strategic Needs Assessment report on page 35 to 50. Rebecca, would I be right in thinking you're taking this one?
Hello, sorry, it's Rebecca Cohen, so I'll be taking this one.
Okay, please proceed.
I'm sorry, I was going to sort of run through a PowerPoint presentation, but for some reason it won't actually allow me to take you through it. I believe in previous meetings you've spoken effectively as a board about the possibility of linking your joint strategic needs assessment with that of Cornwall, and sort of basically investigating or linking that work with ours, and hopefully this provides a bit of an opportunity just to let you know the approach that we're taking in Cornwall and set out the proposed approach for integrating the Isles of Scilly into that. I mean, as you know, it's the Joint Strategic Needs Assessment is a requirement for both boards, both the Cornwall and Isles of Scilly board and the Cornwall board, and is it's supposed to set out a shared narrative for the health and wellbeing needs of the population. In terms of who uses the JSNA, obviously we've got a quite diverse audience. So we've got commissioners using specific items. We've got people from the STP, the one with vision. And then we also have other public sector, voluntary sector and private businesses also using elements of the Joint Strategic Needs Assessment as well. Now in Cornwall, and I think you've got this link within your paper, all our resources are online, so they're available at cornwall.gov.uk/JSNA. And I think, it goes through, we already have some items that are set up specifically for the Isles of Scilly. So we have an area profiling tool that has a specific report for the Isles of Scilly. And then we also produce population demographic tables that are specific to the Isles of Scilly as well. However, we don't, obviously, given that currently you have your own JSNA, we don't currently have any products beyond that point at the moment. What we do recognise, though, is there is always room for development with joint strategic needs assessments, and they're not always positive. And sometimes what we need to do is sort of have some feedback. So what we've done is we've gone out to various partners and just asked, how we could improve the JSNA. And increasingly it's the availability of data, but also people don't want to wade through massive documents. they'd also like to get to the key issues in quite a quick way and have an easy visual way of being able to see what the key issues are, either for a particular topic or a particular issue. And obviously in doing that, we need to be quite mindful of the different audiences that we have. Now, what we're proposing at the moment, and what the Cornwall Health and Wellbeing Board have agreed, is to produce 29 topic summaries, and I hope that you will have a copy of that in your pack. You should have a copy of the cancer summary as an appendix to your papers. That's just to provide an example, but essentially those 29 topics would be on a consistent template. And using that approach, we'd be looking then to extend that in 1920, so the range of topics, and also consult with both boards, hopefully, if you agree this approach, on how we develop that in each area and how we build on the products that are available for each. You have in Appendix 2, I believe, set out the proposals for the specific papers that we're proposing for this year for the Isles of Scilly. As I mentioned, we've already have the socioeconomic profile, which is already available, and the link to that should you wish to go and look at it. And then there's a proposal about draft demographic summary, so we would produce one specifically for the Isles of Scilly, and that would also, we would also be looking to create specific bespoke projections which are aligned to your local plan, rather than use the Office for National Statistics ones, which currently show a steady decline over time. And obviously we know with your proposals at the moment for building that wouldn't necessarily be the case, so that we could do some work with that alongside Cornwall. We'd also then create a draft population health summary, so we'd be looking at the information that's available for the Isles of Scilly that we are able to publish, and putting that into a bespoke product for you. And then to be doing something around accessibility, because obviously there are specific accessibility issues on the Isles of Scilly. And again, we've set those out for you in the paper. And the last one for this year would be poverty and deprivation, because there are specific issues on the islands which differ from Cornwall and which would need to be pulled out separately. So that's the proposal. I think you've got the report and you've got some of the recommendations. So really we're just looking for feedback from you as to whether or not this is something that you would like to proceed with.
Thank you very much indeed. Do colleagues have any comments or queries to Rebecca, please? Councillor Grottick.
Thank you. I'll be perfectly honest, in the past, when I've read through some of these reports, I felt quite depressed because they were so Cornwall-centric, perhaps understandably, that I struggled to find a place for us. So I'd like to commend this report. It's not only clear, but it does recognise a lot of our challenges and our special circumstances. I'm especially pleased that you flagged the transport area, because accessibility to health appointments is a very salient challenge for many islanders at the moment. I'm very pleased to see that. I'm also pleased to see the note on page 49, the limitations of the national methodologies when applied to Scilly, which is also very relevant. So I think it's, at this time of cooperation and integrated services, it seems a very sensible way forward, with the proviso that we need to monitor how we can make sure that Scilly's voice is heard. And I'm very heartened by this report as a first step in that direction. So thank you very much.
Thank you very much. Could I just ask Rebecca, obviously a lot of this is data driven, and Scilly's data is historically difficult to disaggregate sometimes from Cornwall. Do you feel you have the island specific data which will help inform some of these topics?
Yeah, we have quite a lot of it. You are entirely right. And the Isles of Scilly presents us with significant difficulties in terms of presenting some of the data occasionally. When you get into quite rare conditions or certain conditions, obviously with the numbers on the islands, it's very easy then to inadvertently disclose individual information. So we need to be very mindful of that. And I think, what we're proposing, I think I forgot to mention that in developing these products for you, we would want to work with you to ensure that the narrative, was properly presented. But I think, in the absence of where perhaps we can't present a particular figure, I may have those figures, but we can't necessarily publish them. We may be able to present a narrative which would give you a flavour of how Facilis differs or not from Cornwall or nationally. So I think there's ways that we can approach this to give a better approach perhaps than we've had in some of our previous reports, and to give a proper reflection of some of the issues on the Isles of Scilly.
Okay, thank you very much. Our Chair of Health Watch has got his light on. I think he may have something to raise.
Yes, could I just ask, on page 11 of your report, under the heading of draft accessibility summary, which starts on page 10, you have a list of services, amongst which transport, I'm pleased to say, is included. You also have Health Watch stroke residents' views. There's a question mark. Could I ask what the question mark refers to, please?
My question mark was simply that I hadn't spoken to you, unfortunately. So
you have
just
now.
Literally making sure that we were able to have those conversations, and that you were willing, to work with us, and that we could present that within the JSNA if you're happy to do so.
That would be absolutely no problem. I mean, we have at the present moment an annual report that we make, which embraces the way we see Health Watch moving forward in responding to residents' comments and needs. And also, we are in the fortunate position of every 18 months or so conducting a resident survey, which goes to every household in the on the Scillies, and that does pull together some quite interesting views of the people of Scillies. So please contact us anytime. We're open all hours. Thank you.
Thank you for that. I will be in touch shortly.
And I'm sure that open door policy goes for almost every other organisation or agency based on Scilly. I can't imagine anyone would want to be too defensive. I'm sure if you've got any queries, we can signpost you to the right people as well. Dr. Pickin.
Yes, Chairman, I think from our side, this is absolutely welcome. This is something we do want to see. The more open and honest we can be about what we do need, and it's in a public forum, the better this will be for us. And I think the better it will be for Scilly to actually develop our services further. So certainly from a health perspective, we would be supporting this completely.
Thank you very much. I guess I just have a sort of, I don't want to be cynical, but in 12, 18 months time, we've got a really good JSNA. What then? How can we be sure that it does open the doors, does pull the levers we need to improve services? Have you got any feedback on that, Rebecca, how you think that might be achieved?
And I think the plan is, so with these we will have the range of products. We will then develop an overarching product which pulls together some of the key issues. I think that will be taken back to both yourselves and the Cornwall Health and Wellbeing Board as well. So I think it's at that point really where you can start hopefully to have those conversations about some of your priorities and help drive those. The other aspect would be that if you have these documents and that they are evidence-based, it allows you to have those conversations as well through the STP, through some of your other avenues as well. I'm afraid it's not going to wave a magic wand for you. It still requires, the conversations to be had between you as decision makers, but it does provide you with that evidence-based platform to do so.
Thank you very much. I suspect in some cases it will reaffirm what we already know, and as you say, it might give a bit more evidence and clarity to some emerging discussions. So I think we have 4 recommendations.
Sorry, Chair, would I be
Please do, absolutely, Caroline.
Thank you. Sorry, so I wasn't there at the beginning. I do apologise. I'm Caroline Porter, if you wasn't know me. I'm one of the public health consultants. I also apologise on behalf of Steve Brown, who's the interim director of public health, who at the last minute wasn't able to make this meeting for family reasons. I just wanted to make a point around the recommendations, if I may. It does also refer to the last question, and that's, what is the point of the JSNA? And I would say that there are it should feed into two really important areas. One is the work of the council. So in some respect, that is up to the council to make that live and to make that relevant. And the other is around the health and wellbeing strategy. And I think where we would like to go, and this is something we'd like to discuss with you, would be having a health and wellbeing strategy for Cornwall and the Arthur Civic, so for the SDP footprint. And we've had discussions with NHS colleagues about that, and that seems to be the right way forward for them. But I guess it's a conversation with you about how you would feel about that. I mean, I hope we have reassured you in what Rebecca has said, that within the limitations of data available, that we have considered the Arthur Civic as a separate entity with some of the products that she's talking about, including the demographic summary and accessibility summary. So we wouldn't, just lose the Arthur Civic within the wider footprint. But I just personally would suggest that a health and wellbeing strategy for the SDP footprint would make sense. And that is recommendation 4 in your notice.
Thank you very much indeed. Certainly from my point of view, and I'll throw it open to members, it does seem to make sense if we're moving this down this route with the JSNA. It sort of keeps things aligned with having the health and wellbeing strategy, but I don't know if comments from around the room would be supportive or contradictory. Dr. Pickin.
I think if I can ask Rebecca, do you envisage there being any negatives with that plan? Any negatives specifically to Scilly?
No, I don't think so. I think in some respects there are some similarities in terms of the health and well-being between Cornwall and the Isles of Scilly. I think it will always depend on how that is written and how it's presented in terms. And I think you've already identified within the room that Scilly's has some of its own very specific issues, and I think they can be identified within the same document.
Thank you very much. So I suspect what you will be hearing from us is silly, where it sort of could be going down a Cornwall route. So I think if you're willing to be nagged by us, and I think Councillor Grottig alluded to that earlier, that she was impressed by how much Scilly specific references there were. We will just keep nagging you to make sure that Scilly is referred to as an entity rather than just being lost in the narrative, if that's acceptable.
I think that would be a very helpful check and balance. Thank you.
Okay. So if we've got no further comments, are we happy to move through those 4 recommendations, perhaps on block? Any objections to going ahead with those? I think on that basis we can accept that the recommendations have been accepted at this end. Thank you very much, Rebecca.
Thank you.
Would I be right in thinking some people have joined the meeting since we started?
Hello, yes. Ellen Wilkinson from Cornwall Foundation Trust.
Welcome.
Thank you.
Adam Taylor, Chair of the Health and Wellbeing Board in Cornwall Council.
Good morning, Adam. Thank you for joining us. It's obviously easier if you're in the room just to stick your hand up, but please, like Caroline did, if you do have anything to say, just talk across, butt in, whatever you need to do. Don't worry about politeness today, just have your say. So I think we now move on to agenda item 5, which is the One Vision update from Aisling, who's in the room on St Mary's.
Okay. One Vision, as you're aware, we are members of the One Vision Partnership Board. Myself, a representative of Healthwatch, Penny Penhoward, a representative of the Isles of Scilly Parent Carers Forum, Tracy Smith, and Chairman of the Health and Wellbeing Board and Chairman also of the Children's Trust Board, Joel, attends these partnership meetings 4 times a year. I am also a member of the exec group, which is the kind of steering group for the programme, and also the vice chairman of that. So One Vision, very similarly to Shaping Our Future, which is focusing more on adults, but there are obviously linkages, is looking at integration, how you support families to have single conversations at the right time with the right person to receive the right services. There's been some really good work coming out of it. There's been a whole review of the pathway for those waiting for autism spectrum disorder, etc., etc. And there's been a huge amount of work done on CAMS. And I think particularly on CAMS, we're seeing the impact of that on our own services. We've got a very strong emotional health model on the Isles of Scilly, and we're getting very good attendance from a CAMS psychologist at our Bloom meetings, which is a very pioneering multi-agency way of working, which has proved so successful on the Isles of Scilly and in Penwith. It's now going to be rolled out throughout the county. So yet again, we are kind of leading the way. I think the thing is, one of the key elements of the One Vision programme is the idea of a family hub, which is about a single front door for families to access services. And with the transfer of school nursing and health visiting into Cornwall Council, and therefore into our council, you've got even greater opportunities for integrated working. So the plan to make One Vision even more of a reality for people on the Isles of Scilly is to hold a workshop in the next few months with service users and co-produce what that family hub model looks like. Those of you who work, Dr. Pickham will tell you, those of you who work with children's services will say how incredibly strong the partnership working is. And the family hub model will just be a kind of more formal bit of governance that supports that. So some very exciting opportunities. One of the other bits of the One Vision programme, as you're aware, was that Cornwall were looking at an alternative delivery model, which was looking at an arm's length company to run children's services. That's now on hold, and Cornwall Council are now looking at an integrated services directorate, which is pretty similar to the kind of way that we're working at the moment. I think that's it for now, but I do feel One Vision is on the right path and there's some really good stuff coming out of it. We also have a call in December where we're going to look at the crisis pathway for young people experiencing a mental health crisis, which is actually very timely for all sorts of reasons. So again, we are getting linked into those specialist services.
Thank you very much, and apologies for putting you on the spot there. I think the agenda ran it yes. Any queries about One Vision from around the county, please? In which case, I think we can accept that verbal update. And I would just echo what Aisling said. I said it One Vision, and it's just very clear that the issues we face on Scilly are so closely replicated in Cornwall. It's great to be able to have that sort of shared partnership approach to be able to hear what's going on and explore some of the solutions together. So I think we're just jumping around for people who've joined the meeting. Item 4, I think, is probably will get us back on track, and that's our Shaping Our Future update. I'm not entirely sure who's leading on this one.
It's Jackie, so I'll kick off on this and then invite colleagues here, Rachel and Tim, to come in. I know Justin has been trying to join the meeting as well, so obviously he's going to pick up the development around the integration on the island itself in terms of the outline business case, but he's not been able to join for some reason, so we'll do our best. I know he's
Jackie, is Aisling here? I can do that.
Okay, brilliant, thank you. Okay, just to kick off then, this is obviously a very generic update. There is a section in it that relates specifically to the Isles of Scilly, but we thought we ought to also give you a good overview of all the work that's happening, even though some of it might not directly relate to you, like the community hospitals piece that's in here. The only thing I would pick up based on One Vision is Shaping Our Future is everything. So it's all ages, all communities. So the One Vision does sit within the Shaping Our Future programme as well, whilst it's being run under a unique, well not unique, but a separate governance process. It is all feeding in, because this is about making sure that whole communities, whole families are looked after, not just trying to separate bits of the work out. So overall then, we've continued working on the community-based model of care for people, trying to ensure that people get the right care in the right place as quickly as possible, and trying to keep people in their local communities fit and well for as long as possible. We've been using what we're calling a kind of test and learn approach, which is rather than seeing a mass transformation programme, actually just doing things, learning from them, tweaking them, revising them, doing them again, and just carry on that continuous improvement approach to this. Sorry? Oh, was it? Okay. So to run through quickly the section, so we've got an update on community hospitals. You will be aware that on the mainland here we've had 3 community hospitals that have either been fully closed or temporarily closed as of operational issues. We've done some really good work with small groups of local stakeholders around each of those sites, but we've come to the point now where we need to formalise that work and broaden it to a bigger conversation with the local population about what the options might be based on the needs of those local communities. And I guess, again, linking back to that conversation we just had about the JSNA, that would be absolutely fundamental, because we need to start with the needs of the population building. So we start with what are the needs of the population, what are the best way to meet those needs, and therefore what might be the role of those buildings or other buildings. So it will come very much from a needs-based approach. In the paper it sets out the proposed timeline, and obviously one of the questions you wish to consider yourselves is what might be the role of the Isles of Scilly in those conversations, and whether you obviously want to take this through to your own scrutiny committee. You won't be surprised to hear that Cornwall Council Scrutiny Committee is absolutely all over this and wanting to ensure that we follow due process to make sure that we get a good outcome for local populations. But I don't know if you want to pause at that point and consider the community hospital bit specifically.
Within your work, is there any evidence or indication that individuals from Scilly would be directly or indirectly impacted by these closures?
Not that I would be aware of. I'd be very surprised if somebody from Scilly went into Edinburgh, for example. I guess where the impact might come is that we might, for example, say, how can we get better home-based care, or how can we enhance the use of Wesleyan Hospital, for example. So that is where there might be some implication in terms of, what else could we do rather than people going to either Edinburgh or up to the main site at Trellis.
We have the second recommendation on our paper alludes to referring this item directly to our scrutiny committee for them to consider perhaps in more detail than we as a Health and Wellbeing Board. So I'm happy to work with our lead officer and our chair of the scrutiny committee to ensure that that option is considered by scrutiny, if that would help.
Okay, I mean, clearly that's your decision, so. Okay, we take that as read then.
Okay.
Moving on to section 3 then, where we start talking about urgent care. Again, when we kicked off Shaping Our Future, I think with hindsight, we realised that we made some unhelpful statements in the original documentation. We made statements like we were going to consolidate services into fewer urgent treatment centres and we're likely to therefore reduce the number of minor injury units. I think we realise now, and have heard loud and clear through all of the co-production sessions, including the ones on Scilly, that actually that's the wrong answer. So we very much have amended our approach, and we're looking at a network of urgent care provision, ranging from high-tech emergency departments, both at Trellis but obviously in Devon, and then looking at what else can be enhanced at other places around the path. So we are looking at urgent treatment centres with access to CT scanners in a number of locations, and again those are set out in the paper. And we're then saying, apart from the 3 hospitals that we've just talked about, there are no plans at all to close any other minor injury services anywhere across the patch. If anything, we all know we're a tourist population, we all know that we've got population growth planned over the next 10 years, and actually those services are more likely to be better used than underused, and our plans are certainly to keep them in place. Again, the answer for the answer Scilly will be different again. So, this is about working with you and colleagues on the islands to say, okay, and what can we do for the islands? How can we enhance the offer? The offer you already have is different to the services that operate on the mainland. So, how do we use you continually as the test bed to say, okay, let's push the boundary and see what we can do here closer to people's home? and then we can learn from that and replicate it over here as often as we can. So I wasn't going to say anything else about urgent care, but I was going to hand over to Tim just to cover the mental health update, and then Rachel just to talk a little bit about the specifics of Isles of Scilly.
Thank you, Jackie. And thank you for the invitation to join the meeting today. Ashley, can I just first thank you for your support over the last year? Ashley was pivotal in helping us develop last year our response to NHS England's 5-year forward view at the core of the City Mental Health Delivery Plan, which sets out a programme of transformation in a number of areas, including crisis care, community care, and delivery of evidence-based talking therapies. I'm not sure it's of huge value to go into that document now, Chair, but I would be prepared to take any questions as they arise. I think we clearly set out in that document 15 priorities, a number of which are 5-year forward view, and a number of them are local priorities too, including the development of adult ADHD pathway, which we're progressing as we speak. In terms of the delivery against the transformation priorities, it's fair to say that Cornwall and Scilly are ahead of the game. We're moving forward positively in terms of the outcomes that we're chasing. We've identified additional investment within the mental health investment standard for this year, and we're planning now what that might look like for next year. And the things that we're able to deliver are an enhanced psychiatric liaison service at RCHT, which incorporates the new Core 24 model that enables us to meet the national standards, 24-hour support with some waiting time standards around assessment and discharge. That's an embedded service, and at the moment it's functioning certainly above the fidelity to the national model, which is fantastic. We've developed for our communities the specialist perinatal service, and that's developing very well, supporting a number of families, certainly vulnerable mothers who very sadly have experienced an psychological distress related to the pregnancy. We're working with our council colleagues here, public health colleagues, around suicide prevention plans to hopefully reduce by at least 10% the instances of suicide across our communities. We're probably a very outlier, unfortunately, in that area. We've got quite a robust plan together, which hopefully you've seen, and if not, we're more than happy to circulate again. We've been looking at supporting the criminal justice mental health pathways, and we now have in place other areas calling the street triage service, which is about enabling mental health to support their police colleagues in early intervening around those who may require detection under Section 136, hopefully reduce that, and enable people to get onto health-based pathways, an area which we did discuss when we came over to Isles of Scilly in June, and I'll elaborate on that. In addition to that, our psychological therapies interventions, which are provided at a mild to moderate level by Outlook Southwest, our main IACT provider, improving access to psychological therapies, who were previously challenged in terms of their performance about their recovery outcomes. I think we're all overwhelmingly pleased to see that their performance has maintained a steady state above the nationally required 50% for the last 6 months consecutively, which I think is fantastic news. In terms of the numbers of people accessing their service, we're seeing that improve month on month. Having said that, for the last 3 months, whilst they've put some staff forward for additional training, that has dipped off, but we're aiming to get back on trajectory for a year-end above target position, which again, I think is fantastic. We're developing with Outlook Southwest the long-term conditions pathway as we speak, so that we can start to address more adequately physical health needs in respect to mental health needs, addressing some of the comparative esteem issues. I'd just like to come on to the visit that was posted by Ashley. Thank you for arranging that for myself, a colleague, and Outlook to come over to the Isles of Scilly in June and hear firsthand not only some of the fantastic work that's going on, so it was great to meet some of your colleagues and lead professionals there, members of the community, service users and carers, but also some of the challenges. And I came away with an overwhelming sense, I think, that there's a lot of cohesion on the island, there are a lot of very unique solutions, but it's not always as joined up as it could be when it comes to the mainland, so we needed to understand what we do there. Ashley, I don't know whether you're going to be describing this in a later agenda, but I think it's probably worth us reflecting on a solution that we certainly have in place for the next 2 years. Would that be reasonable to describe that now? What I noticed myself, and I think was reflected in conversations, was that there are island-based solutions, but on a number of occasions they have been quite reactive. I think I certainly heard people say, if only there was some expert support and intervention earlier on the island, I wouldn't have deteriorated so quickly, and I wouldn't have needed an off-island care package, which in some occasions, as I know, have been delayed for days due to inclement weather. I didn't personally feel it was sustainable. I wouldn't have wanted that for my family. So we worked up a solution in terms of a post for the people on Isles Scilly to not only enable them to access mainstream services, and those delivered by the Cornwall Foundation Trust, but also to access the evidence-based psychological therapies, not just cognitive behaviour therapy, but also some integrative counselling services, and hopefully to try and navigate and coordinate everything that is going on the island. We hope that that will deliver early intervention, prevention, and some sustainable outcomes. It was interesting to have a conversation with your GP, who I think is present. It's nice to see you around the conversation about crisis interventions. Hopefully, this individual will be able to early intervene in some of those situations to avert some of the crises that you've seen on the islands on a number of occasions. I think that's probably what I have to say at this stage. My plan would be to come back in December, hopefully to see this post holder in action. I'd like to speak to the wider team on the islands to understand the impact, and again to speak to service users and carers to understand the value to them in this. I'm prepared to take any questions.
Dr. Pickin.
I'd just like to feedback on the mental health side of things and pass on a number of thanks, actually. Thanks to Aisling and the team on the mainland for CPFT for helping to develop the CPN post, which is coming up. That will be absolutely invaluable to us, will be extremely useful, and I see that post getting a lot of use, both preempting problems and also dealing with problems. I would like to also, if I can, just take the opportunity to thank the CCG who have helped us recently develop some emergency care pathways for local residents. That has been extremely valuable as well, and thank you for organising funding for that as well. With regards to MIU and urgent care and community hospitals, I agree. I don't think the mainland closures will have significant effects, but would just like to add the absolute value and priority that those assets give us locally. Probably save both considerable money and also are extremely valuable to the community. So I kind of agree with the points that have been raised, but particularly regarding the mental health side of things, I think that's going to be extremely good news for us going forward. So thanks from our side. Thank you.
Thank you very much. We've got item 10 on the agenda is the Better Care Fund, where we might again bring this up. But I would again echo thanks to everyone involved in whatever effort they did to get us to this position. I sometimes wonder, like other chairs of health and wellbeing boards, if we are too much of a talking shop, but if we've achieved anything this year, hopefully we'll leave the meeting in an hour or so, having made a good step forward around mental health. So that's, from my point of view, something to be optimistic about. Any other comments around mental health at this stage?
Ellen from Cornwall Foundation Trust, just to endorse that, and that having the island-based service will be a definite move forward.
Thank you very much.
Yes, can we just, sorry, to make sure can we just talk about the model of care workshop that is described later in that document as well? Because I think it follows on really well from Jeffrey's instructions about shaping our future, and the conversations so far that have been tends to be quite high level, and a number of engagement events on the Isles. The next step of which were a couple of workshops last week, which a number of us, including myself, sadly, weren't able to get to because of the awful weather. And it's a really apt reminder that we always need to have a plan B, and perhaps plan B becomes the plan A in the Scilly, and that relying on, you know, the dreaded little tiny plane that I hate isn't necessarily the best plan, but we were incidental to the whole occasion. And from what I saw on a site link in the Queen's Hotel in Penzance, it was
first time, it's designing a process of being able to speak to staff on the ground to develop the model of care. Now, this is a new way of doing this as part of the Shaping Our Future approach. And it's the first time we've done it on the Isles of Scilly, and that's going to create a blueprint for doing it on the rest of the mainland, with South Carolina following suit at the end of November. So from what I saw on screen, it was very well attended, and it was a very good atmosphere, and it was led by the undoubtable Tracy Hind, who's facilitating from the CFT. Ashley, is there anything else you wanted to say about that? Because you were there.
Yeah, I was actually there. So there was, we had in total about 70 people came over the 2 days. So we had hospital staff, and that's all hospital staff. We had primary care represented. We had Park House represented, the voluntary sector, some service users, Health Watch. It was a great couple of days, really tiring. Tracy Hind, who is the Workforce Transformation Lead from Cornwall Partnership Foundation Trust, came over with Marie Pryor, who leads on the frailty and falls pathway, which, as you know, is one of our key priority areas of work, came over, and then Alice Rawlings. And they commit, and Anita Cornelius, who's the Associate Director at CPFT, and they committed to come over even though they knew they would be stuck till Saturday, which I think meant a lot to the attendees, because obviously this is the experience of not just our workforce, but actually more importantly our service users who need to go to appointments in Trellis can find themselves stuck in Cornwall for 2 days. So really, really, really good outcomes. And again, this model of care is there to shape the future kind of estate model and IT solutions and so on. But we all agreed that we wouldn't wait for that to happen. So there's some key actions that are going to come out of it immediately. I'm having a debrief session with all the team on Monday, and then we'll start circulating some of that work. But for example, it's been committed that we're going to set up an integrated little mini management team on the islands with Scott Fuller from Adult Social Care, Anita Bedford, who is the integrated care manager for CPFT, and the new integrated mental health practitioner are going to work together to develop some of the ideas around things like a single point of access, around shared paperwork, about the whole spirit of partnership working and why it's important. So it was an incredibly productive 2 days, and we had excellent feedback from every single member of staff who came. And if nothing else, it was a good social opportunity.
I'm delighted to have missed it, actually.
Well, it was really fun. I just wanted a wider point, because I totally pick up what you were saying, Jackie, about the integration between One Vision and SOF. But One Vision isn't provided as an update in this paper. So I think there are just more and more things, and I'm really happy to support. How do we therefore link those two work streams so that so we are reporting it together? Because so then we just are underlining that point, because you're right, I am still saying this is children, this is adults, and it's not what we mean. We're doing whole communities, but I think therefore we need to work out that interface in our reporting.
Yeah, no, that's a fair point, actually. No,
and I'll absolutely help from the Scilly side.
Yeah, okay, brilliant. And I guess it's worth saying, so at the very end of the paper talks about what do we mean by an integrated care system, and I think we need to not focus on that end of it, because actually that's about just how we work together in networks to make sure that frontline services deliver what they need to deliver. So we are trying to organise ourselves into what we're calling 7 integrated care areas, one of which is the Isles of Scilly. And very much exactly as people have just said, set up leadership teams at that level so that they are absolutely empowered to make decisions and plan services for their local communities. So everything Ashley is saying that you're looking to do there, we are actually looking to replicate over here in local geographies as well. And that is a new way of working, so I think we have to be clear from both council colleagues and the NHS. We're not very good at letting go and letting local communities get on with it, so this is going to be a bit of a test for us as well, and we won't get it right first time every time. But we're really encouraging local people, local professionals to kind of challenge us back up and saying, hold on, that isn't what you said. You said you'd let us design it within obviously certain parameters, but you need to trust us and let us do it the way we think is right for a local community. Now, I think for you, that will be particularly important, and we absolutely recognise that.
Thank you very much. Within the paper, there's obviously reference as well to estate and capital projects on St Mary's. I wondered if we could just have a brief overview of where we are with that.
So where we are is that the PID, Project Initiation Document, which is also essentially the strategic outline case, has gone to all partner organisations who are involved in this. So in terms of the local authority, it's gone to scrutiny and was endorsed with a minor tweak to enhance the bit about the off-island locations. And then it's got a cover note now, and Carl Simpkins is going to socialise it within CPFT. I think we're talking about taking it to the Soft Transformation Board in January. And once it's gone to all partner organisations, it will then go to NHS Project Appraisal Unit. At the same time, I'm currently writing a bid to One Public Estate for phase 2 of funding to support the full business case. Obviously, we'll only do a full business case if we're happy that the outline business case stacks up, which is, and that bit is actually already funded. But yeah, we're pursuing £250,000 worth of funding towards a potential full business case cost of £500,000. There will be a requirement for partner agencies to match fund. So there will be discussions at the appropriate gateway with my own organisation and with health about how we look at that shortfall. There will also be a capital funding bid made in the summer to the STP Estates Capital Fund. So, I mean, there's a lot going on, but the important thing is whatever it is that we are pursuing, it will be based around the model of care that is designed by this community. And it was very clear in the conversations when we were talking last week that the majority of our staff are very, very on board with how useful it would be to be co-located. I think I failed to mention that South West Ambulance came along and they were just an asset. And we talked again about what is the MIU service for our islands in the future? Is there a kind of plus element there as well? And their input will be essential. And I think they would very much like to be back in the fold with health. They're down at Porthmelon at the moment. So there is a lot to be said for the estate in enabling people to work more closely together, as well as providing better outcomes for people. So that's all going ahead, lots of work to do. And some of you are actually on the programme board for the project. It's also been agreed that the programme board will send updates to full council on a regular basis so that you feel like you're on top of what's going on.
Any queries around any of the points raised? Chairman of Council.
Thank you, Chairman. Yeah, I just have to say I just can't get my head around the cost of the full business case. I just cannot believe that it's £500,000 cost. You know, you're talking about paying a reasonable executive wage for 10 years to fund. I mean, I'm sorry, I just can't get my head around it at all.
What I can do after this meeting, I can send you all what goes into the full business case. So it's not simply a document. It's lots of processes in it. So it's about writing a general economic model. It's about getting all the planning through. It's about doing site investigations, feasibility, design work. So you get the entire process before you then commission your builders. So it's all of that work, and it's based on the rule of thumb on what the likely estate is going to cost, around 7.5 million. So therefore it's based on a percentage figure on that. So it's not about simply a report saying we think it's a really good idea. It's actually a whole set of documents that means that you are ready to start on site.
Well, I accept that, but £500,000 in order to have a full business case. I'm sorry.
Architects and so on. Well, I think if I yeah, absolutely. If I pick that up, we're not approving that expenditure at this today, but if I pick that up with you with the project manager when they're over in a couple of weeks' time, maybe have a discussion. But this is based on Treasury Green Book kind of principles, so that is the cost.
Thank you very much. Any further comments from either in the room or around the county on any aspects of the report before us this morning? So I think we have two recommendations before us, and the board is noting the current position. And it seems like there's some tangible changes very much on the horizon. And we've already addressed the issue in terms of referring the community hospital query to scrutiny committee for them just to consider whether they want to take that any further. Unless there are any further comments, I think that allows us to move on to agenda item 7, which is making every contact count.
Thank you, Chair. That's me. And it's also me, I think, for the following 2. So I'll keep each one reasonably brief.
Thank you very much.
They do sort of interlink because they're all about healthy lifestyle, essentially about behaviour. So making every contact count is a national initiative. It's led by the NHS. And essentially what it's about training people to give them the skills and confidence to have a conversation. And that's a conversation about people's health and about behaviour change. So in terms of who would get the training, it's not just health and social care staff, it can be much wider than that. So it could be school staff, the police, the voluntary sector. And in terms of who they would have the conversations with once they've had the training, again, that could be really anybody. So it could be the public, it could be their own friends and family, it could be their work colleagues. So in terms of what the training looks like, I think on page 63 there's an appendix that gives you the type of training that's available, and it's been designed to be as broad and accessible as possible, bearing in mind that people have different amounts of time that they can give to this. In terms of what's going on in the Artificially, I think it's really positive that Cornwall Foundation Trust have made this mandatory training. So St Mary's will have all the staff there will have this as part of their mandatory training programme. But it could be extended to council staff, to members, to whoever. So I suppose the ask is really that the Health and Wellbeing Board supports this as an approach and also considers how it might be used on the islands. That's all at that point for questions. Thank you.
Thank you very much. Any queries from around the table or virtual table? Certainly the 5 key areas where we're talking about stopping smoking, being physically active, healthy eating, managing alcohol intake, mental health and well-being, obviously a core to what we're doing as a health and well-being board, and also aspirations for us as a local authority. My only concern is around the practical issues around how we roll it out, how we deliver it, how we facilitate it, all those back function type aspects, if you like. But I think that's perhaps for us to have conversations amongst our own organisations and agencies. But I think as a concept, I would like to think the Health and Wellbeing Board is supportive.
Just a comment from CFT. Some of the training that we have been offering, as you can imagine, for the sheer number of staff this involves is e-learning. And so one of the the values of that is people can do it flexibly, and it's relatively cheap. So it's not the be all and end all, and there are obviously limitations to e-learning, but it is something that can reduce some of the barriers to training, particularly on the islands.
Thank you very much. Well, I guess part of my role is to liaise with the colleagues in children's social care, adult social care, children's services, some of our sport and leisure people, those who regularly come into direct face-to-face contact and are likely to have some of those conversations and see the best route for moving things forward. And I guess, Caroline, you've got learnings on how that can be rolled out from what you've done in Cornwall.
Yeah, absolutely. We have a coordinator who is rolled out in Cornwall and has learned a lot from that process. So very happy to have a conversation about how we can perhaps make it work best on the islands.
So we have 2 recommendations. One is that the Health and Wellbeing Board endorses making every contact count as an approach we want to take forward, and that organisations commit to supporting further implementation of the agenda. So are we happy? I'm not seeing any issues in that. It's just, as I said, pursuing the practicality to see how that can be rolled out. But I think following those conversations, we're happy to see whatever we can do. We're getting lots of nods around the table, Caroline. Does that concludes that item? If you wanted to move on to your next one, I think.
Okay. So the second one is around the local government declaration on tobacco control. So we'll start with the evidence. To the best the data we have, smoking rates on the Isles of Scilly are around 19% of the adult population, which puts you in line with Cornwall and the rest of the country. And nationally, the rates of smoking are declining, but that's not a reason for complacency. It's still the single biggest cause of premature death. So what this is asking for essentially is to adopt this declaration, which has been adopted by a number of local authorities around the country, including now Cornwall. And essentially, the commitment that it requires is on page 76. So that's about the council making a public commitment, and by that we mean a sign-off by the chair and chief executive and publication on the website, the council's website, about generally increasing awareness, and also about having a development plan, and also with that, monitoring of that development plan, because everyone having a plan to actually implement it and monitor it. So we would, as a public health team, we would lead that on your behalf. That's probably what I say about that.
Thank you very much. I was certainly welcomed comments about Smoke-Free Cornwall was looking to extend its name to reflect Scilly, which seemed like a positive to me. What I wasn't clear about is obviously we're the Health and Wellbeing Board, and we would probably need to take this to full council, potentially with recommendation from Health and Wellbeing Board. I don't know if full Health and Wellbeing Board can necessarily do this on council's behalf. I don't know if other council colleagues in the room would be able to give any steer on that.
I think that's probably a sensible idea, just in case we've inadvertently
overstepped,
not complied with the relevant protocols. And anyway, I think it'd be a good idea to share such initiative with our colleagues.
Yeah.
So,
yeah, really good. So again, it's all about giving it as much visibility as possible.
Absolutely. So I think what we're moving towards is we will probably look to take a paper to full council based on what's before us today, for full council to take a decision on putting its name to this agenda, and I can work with Bob to oversee that. Okay. Any other comments around smoke-free, Scilly, Cornwall, tobacco control?
I think just looking at it briefly, I don't think there's anything hugely contentious in it, but yeah, absolutely took it to full council, but I don't think there's anything that we would particularly disagree with.
Thank you very much for that. I think with that acceptance, it moves us on to item 9, Caroline.
Yep, okay. So the final one is around the healthy weight strategy, which is in the full strategy has been given to you here. Again, starting with the evidence, the Isles of Scilly obesity rates are around 10% of the adult population. So again, that puts you pretty much in line with Cornwall. It is something that is an increasing problem, associated with that is a real issue around type 2 diabetes. So this is an all-age strategy. It has 7 objectives around 3 themes. Those themes being the environment, the general environment, support for individuals, and then working with professionals and other partners. It's very timely because of the announcement earlier around the money from Sport England, which is to be welcomed. So that's fantastic. In terms of other things that will be going on the Isles of Scilly, clearly the work with health visiting, with healthy schools, with healthy workplace, and the NHS Health Check programme will be incorporating this. But there are other things that we could do with you, including thinking about whether you want to take on Sugar Smart, that's been taken on in Cornwall, but you may want to take on that, and in which case we'd be very happy to have those conversations about how you want to take that forward. And that's probably what I say on that one.
Thank you. Could you just elaborate slightly on Sugar Smart, what that is, how it's rolled out?
Yeah, it's a kind of, it's not something that you can say there's, you know, a 10-point program or whatever. It has to be pretty much adapted to the local area. So it would have to be a bit of a conversation about how you want to take it forward. And to be honest, in Cornwall, different town councils, for instance, have adopted it in different ways. So I think there's a bit more of a conversation to be had about that. I mean, you could actually bring a paper on it if you wanted to a future meeting.
Caroline, this is Aisling here. I think I did talk to some of your team about maybe coming over at some point to do a workshop which knits together a lot of these different pathways and sort of working out what we can deliver on the Scilly, either using local resource or online resources. So maybe, again, if we could try and pick that up as an action, maybe do that in the new year.
Okay, great. Sorry, so you mean that on, not on the box, but on a much wider...
Well, I think exactly that, just that whole health promotion piece. What's available? What could we do locally? And how do we connect to services in Cornwall?
Yeah, great.
Any other Chairman of Council?
Yes, Chairman, thank you. Yeah, I think a lot of this has been said is about education, really, and understanding what it is, especially as we're about to consider more sites on the island for various food outlets and so on. But I think on the education part of it, it's, I was talking to somebody the other day and talking about, you know, sugar and so on. And they said, well, there's no sugar in pasties, you know. And, you know, it is, you know, we laugh about it, but actually a lot of people don't understand about the breakdown of carbohydrates and everything. And, you know, there is an education thing there. And I think that we need to focus on that quite a lot, Chairman. Thank you.
Councillor Grottick.
Thank you, Chair. I just think it's really sad that we've stopped teaching basic cookery skills in school, instead designing cereal boxes. I know that may be a bit of an oversimplification. I'm sure there is some cookery knowledge, but I had an excellent cookery teacher at school, besides a mother who was a very good cook. And it just lays the foundations for enjoying cooking and eating for the rest of your life. So I think that's something perhaps that, as the Chair says, that's education.
Our school has very good cookery provision.
Good.
I welcome those comments. It really is a holistic approach, isn't it? And as we as a council, if we're thinking about new buildings, developing areas, it's all about safe routes to school. It's about unblocking barriers. It's about encouraging, which is the paper which Nicola introduced earlier this morning about some funding which has been received to try and target those who are less inclined to do some of the physical activities. So it really is certainly not up to public health to sort this. It's in all our planning, all our thinking, how we can try and encourage people to lead healthy lifestyles, live emotional and physical and mental in that respect. And there's all sorts of opportunities which I think we can do as a council, which might not cost the earth, but might have tangible benefits.
Hi, it's Ellen here. Have you encountered the Daily Mile in your schools?
I don't know.
I
don't know. They're doing. Our school has a wake and shake session every morning where children turn up early and do lots of exercise. But I think that in our school, as far as I'm aware, is signed up to Healthy Schools programme.
Yeah, it was something I came across in Guernsey, where they were trying to introduce it to the whole island. So it just might be something to consider.
That's probably something which we can feed into the sort of Sport England funding, isn't it? All those sorts of initiatives which are being trialled in other places could become part of the remit of that project.
Yeah, we are promoting it through Healthy Schools. I must admit, it take off across Cornwall and the others, and it hasn't been great yet, but we're still working on it. And if there's any influence on the other schools, then that would be great.
Okay. Well, I'm certainly encouraged. When I know this is for wider than just children, but I certainly see a large percentage of children on St Mary's walking, cycling to school. Often not as many when it's pouring with rain, but I think we've got a good uptake in terms of a good baseline to start from, perhaps. And I think, go ahead.
No, I was just going to raise another point, if I may, following the comment around sugar in pasties. And that's I'm currently responding to the national consultation on calorie labelling for cafes, restaurants and takeaways. Now, I think that's quite important that the RCCILI has a bit of a think about that as well, because I think it's really important, but of course there are considerations around small and micro businesses and what could be reasonably expected by them in terms of calorie labelling. I think anyone I can talk to, maybe to have an RCCILI input on that.
I don't know whose remit that would fall within.
Island marketing, Island partnership.
We'll put our thinking hats on and see who best to refer that, who to try and connect you into with that conversation, Caroline.
Yeah, I mean, I've had conversations with people like Trading Standards and economic growth. So obviously, I'm not sure what the equivalent would be for you guys.
Okay, we'll see what we can do.
Yeah, I can get back to it. That'd be great.
So we have two recommendations. One is that the Health and Wellbeing Board endorse the healthy weight strategy, which I think we're more than happy to do, and that we can receive an annual report, but perhaps more importantly is the sort of practical side of things, which Aisling alluded to. Perhaps public health colleagues could link in the new year with locally based colleagues to try and look at some aspects of how it can actually be taken forward in practice. So if that's acceptable, I think that brings us on to agenda item 10, which is the Better Care Fund paper.
I'm not sure who's presenting this. Aisling, Jill isn't here. I assumed you were presenting this.
The Better Care Fund?
Yeah.
Yeah, absolutely. Right, so Better Care Funds, as you know, we had an allocation set for 2017 to 19. There was a slight underspend last year, and so we've made every effort to ensure that we use the full allocation this year against approved schemes, which we've been able to do so, and that's been the significant step change in the mental health services commissioning. As you know, we've tried for some years to get something off the ground, and I can't thank NHS Kerno enough, particularly Tim, who came over, as you know, a few months ago and met with all our teams and also, most importantly, service users, and really listened to what they were saying and what the difficulties are. And of course, it was common themes, and it's about having to fly off for appointments and having no one to talk to. We have designed a post which is really quite unique. It's not just about being a CPN, it's about somebody that is going to do that early intervention and prevention work, minimise fly-offs, because obviously flying off for appointments when you've got emotional health difficulties is not great. And we're really excited about this project, and again, it's something that we're thinking could be a kind of case study for other areas. So you actually, they kindly approved that changed expenditure by email recently, and I needed to kind of get ahead of this meeting because I want to get that post holder in place. It is imminent. Someone has been appointed, is providing strategic input into the work we're doing at the moment, and hopefully we'll be practicing within the next couple of weeks. It's the usual HR process, but we're delighted, and I think we're going to make a real noise about it for the community. And I particularly wanted to thank the people who shared some very private experiences which helped develop this post. So because you've committed to it now, that's now quite a lot of it is now funded now for the next 2 years, and it minimises the allocation next year. I'm also looking to see if I can match fund it with some other elements of funding from maybe the Community Safety Partnership, because there is an element of this work which is around the dignified conveyance of a person under Section 136. I think we've got a little allocation there, and I think any other opportunity, because I think this mental health service, I think, is at the heart of a healthy community. So anything I can draw in, I will do. If we have any other underspends this year, or if we have increased income from Buzzer Bus, again, we'll offset it in this year, and that will reduce the allocation required next time. There's been another development around reablements. We've been able to actually now start providing some intermediate care beds, which we haven't ever been able to do on the islands before, and that's proving really successful. We've only just started, and that's because of different capacity in Park House and new staff, where we're providing 6-week care for people for whom it's not safe to discharge from hospital, it's straight home. So it's that intensive therapeutic support. We've got 7 people who have used those beds, 2 have gone home. I can't really give you any more stats than that because then we get into identification, but obviously that's all audited. I send it to NHS Kerno for approval. Buzzer Bus is coming in under budget from where we thought we'd be at the beginning of the year because it makes quite a lot of money. It's doing really well. And actually October, you can see the stats there. October, I think, is the busiest month it's been for some time. As you know, we get amazing feedback about that service. We're about to do a survey soon to kind of get some more data to support that. The early intervention service, which Chris's team manages, is going well. Again, I think there's an opportunity in all the work we're doing to rethink that pathway. There's a lot of talk in the Shaping Our Future update about how people are re-looking at the reablement pathway, re-looking at the frailty and falls pathway. So I think we might enhance some of the elements of that contract when we look at it next year. I'm hoping to bring in proposals for next year to our next Health and Wellbeing Board. We're going to base it on an allocation similar to this year. We're not sure about the future of the Better Care Fund after 2020. Hopefully we'll all be in one big integrated system by then, so there won't be money moving between organisations. It will sit there already within a pool fund, but you know, who knows. But I think it's pretty much good news. I will just say that the printing of the Q2 IBCF return wasn't very good, but hopefully you saw it electronically. Well, I think, Andy, did it appear more clearly on that? Because it's all chopped up in the printing? Yeah. Okay, and then also Health Watch with their eagle eye spotted a typo which no accountant has done on my scheme allocations, which is that I think it's the penultimate appendix where I said in the 2018-19 variance in the top table, if you look at access to services, I had a £13,000 variance. It's actually 10,000. But that doesn't change the bottom line figures. But thank you very much, Ian, for spotting it. He also noticed in my revised scheme update for social prescribing that I hadn't redated it as Health and Wellbeing Board November 2018. So with those amendments, I just would like to seek your endorsement of all the proposals.
I think from my side, Aisling, having a bespoke local physio and CPN or mental health practitioner, it is going to be absolutely invaluable. So I definitely endorse it. My only slight concern is in 2 years' time or 3 years' time, in terms of managing local expectation. If we're not able to fill those again, could be difficult, but that will be one for another day, I am guessing.
I think we've got to remember that the Better Care Fund is system money. It belongs to the system. So even though it's from NHS, I don't design these projects. We work with our health colleagues. So it's not like that money disappears. I just don't know where it will sit in the system. But if we keep talking as a system about what the local system needs, I don't think it's a question. I think it might be much more about how that money moves around organisations. There might be just different mechanisms in the future. To be honest, since I've been doing this job, and even before then, there has been an element of integrated care and health management money going around the system. Wouldn't you agree, Jackie?
Yeah, so I guess actually the only bit we don't know about is the IECF, isn't it? So the rest of the money, as you say, is in the system, but that bit was the additional grant through to local authorities.
Well, we know it for next year, but not for 2020. Yeah. 2020 onwards, we just don't know.
But certainly the health contribution to the BCF is part of our recurrent budget, so that's not very in.
Yeah.
Chair of Health Watch had his light on.
Thank you, Chair. I certainly can't take any credit whatsoever for identifying the financial issues at all. But I did respond to Aisling's email concerning the mental health practitioner and the befriending scheme. I did approach, or at least email, each of our directors and our officers and the response is overwhelming in applauding what I think will be a great step forward. I would reiterate the point I made about ensuring that there was easy access to these sort of services by the community of Scilly, but it not only offers a service on the island, but I think it will also offer the mental health practitioner will be able to offer a wider access or information about services that are available on the mainland. Yeah. And I think that's important. But I don't think I have anything else to say on this other than to say thank you very much, and I think it would be much appreciated service by all involved, professionals and people of Scilly. Thank you.
And you're absolutely right. The key thing is about that kind of access and that link between all services. So the practitioner based on the islands will not only be able to offer a range of therapeutic tools to people, but also be very aware of where people are accessing mental health specialist services on the mainland, about coordinating and linking that. Also being aware of third sector organisations available, also developing some community capacity around emotional resilience, supporting employers to be mindful, dementia support group. So it's a really, really exciting post. So thank you so much for your support, because I know Health Watch have been, for the last 4 or 5 years, you've done a huge amount of work with patients who have been saying this is the big gap on the islands. It's that local presence. There are some really good services on the mainland, and how do we get to them and know what's going on? Additionally, the post holder is actually going to spend some time every month with the mental health team on the mainland. So again, we'll be part of that wider picture.
Yes, thank you. I will sort of, in praise of ourselves, we recognise through various surveys and through our network of contacts with members over quite a period of time that mental health issues are of great concern to people. And so it's really good to have agencies and professionals respond to inquiries that and concerns that we've picked up from local population. So thank you.
It's just been great, and it's a really, really strong testament to what we're trying to do with Shaping Our Future, which is that joint commissioning. So I did this with colleagues from NHS Kerno, and we co-designed a solution with the community. So that's exactly, if we can keep doing stuff like that, we're going to get the model of care we want.
Chair, can I chip in, please, if I may? Again, I absolutely endorse everything that's just been said, and thank you everybody for engaging in that process. For me, it's really important to recognise that this individual is being hosted by CFT, which adds huge value, and let everyone know it's in accessing all those evidence-based pathways of care. So we absolutely need to track the impact of that. In addition to that, the individual will be supervised as well, so that we one-to-one supervision by Outlook Southwest to ensure that they are, tip-top in terms of their skill base for delivering evidence-based talking therapies as well. And I would expect that individual to be able to link in with me at least every month on a number of steering groups I'm going to be chairing, so that we can stay abreast of any changes, any developments, any needs on the islands as well. So there's a strategic link through, I think, which I think will have an even more value. Ashley, I hope that's okay. I'll just jump in there.
And that's all right then. You take over.
Thank you for that. Councillor Grottick's got her light on.
Thank you, Chair. It's great to support several of these initiatives which use local resources to improve outcomes. I think that's obviously, hopefully, the way forward, and it's really heartening to see all this action. Thank you.
Yeah.
Okay. So I just...
which is, I think this resource is incredibly important, and the individual's important, and we're pleased as CFT to be supporting that. But mental health and wellbeing is a whole community issue, and I guess what I hope is that this will add to that rather than delegating it.
No, absolutely, Ellen. And as you know, we've got a really successful Bloom model here. So our idea is not that this now is the person that deals with everything mental health. This is another resource, and that what we want to do is build our capacity across the whole community, and not even just professionals, to support each other.
Thanks for that reassurance.
Yeah, don't worry. No, I know. I think the other thing that I wanted to pick up on Councillor Francis' point earlier about X-ray, we haven't yet designed schemes for next year. X-ray comes back and forth. It's never been an approved scheme to date. It's just that there was an opportunistic moment where we did have somebody who had some relevant skills where there was potential to train them. Again, I do not design what goes in the schemes. It's a joint commissioning piece of work, and I think the clinical perspective currently is that there isn't a business case to support that training at the moment, and that in looking at the X-ray history over the last 12, 18 months, there's only one case where the outcome would have been different if we had had that provision. I think I'll let our lead GP explain.
Yeah, absolutely. Thanks for that, Aisling. I think it's probably worth noting that we're actually data collecting as well. We've started that since August, looking at all our emergency flyouts and comparing where there would have been or whether X-ray would have made any difference at all to that flyout. So that's work that we're looking at along with Rachel Murray and the CCG. So we're going to get back to that probably about January time. At present, there is probably, let's say, in about 50 flyouts approximately. There's probably been 2 flyouts where having an X-ray facility may have, and I say may have, affected the decision to fly out the patient. The reason why I say may is that patients were flown out, were temporary residents, so we had no follow-up on them, and they did not come back to the island. Therefore, at the minute, we're probably working on an average at the moment, let's say, of about 3 to 4%. What we'll do is we'll feed that information back to Rachel Murray and probably Aisling in January time. And literally it's that decision to see whether that is a financially viable model, whether low numbers are still financially viable to have a radiography service locally. Obviously there's the element of cost. From a practical side, the less urgent X-rays, generally speaking, we can manage those on a weekly basis. The only risk that comes with those is if weather prevents a radiographer coming to the islands on a weekly basis, then occasionally those, we may have the odd handful of people that will require a non-urgent trip to West Cornwall, for example. However, as I say, what we will do is we'll feed that information back to CCG in terms of the emergency fly-out numbers and what sort of percentage of, what percentage of patients it would have changed, and again, what those actual numbers are. So we'll get those back to, say, CCG probably around about January time. That will be 6 months worth of data collection.
Chair.
Thank you very much.
Could I raise, this is about X-ray, it's about access to services and non-urgent X-rays. For quite a period of time, Health Watch with other colleagues in the caring sector have argued for X-rays to be undertaken for the X-ray people, practitioners, to actually visit on a Thursday, as they were visiting on a Wednesday. They've now changed to coming on a Wednesday, on a Thursday. Essentially because flights don't take place from Newquay to the islands during the winter on a Wednesday. Now, this is on a Thursday. Sorry, getting my days confused. So there's no access to X-rays for people from the off island. Now, in a way, you could argue, well, why can't people come on the one day and then on the Thursday and do their shopping, which is what they often do. But it's tied in with the Green Marita bringing supplies, fresh supplies, etc. Island life isn't necessarily straightforward for us here all the time, and particularly the off-islanders as well. Health Watch do manage and chair the transport group, which involves a number of agencies, including Skybus and the steamship company, etc. But we have taken a little bit of a step back. We will be trying to argue somehow that to rearrange things. But if there's no flights, then there's no flights. But just to say that the issue is there, and we are trying to work on it. Sorry about being.
I know. I know it's not. I know about this Wednesday issue. Obviously, just as some mitigation. Obviously, the Better Care Fund does fund older and disabled people to get a special boat, and they qualify for 4 health passes a year, which is reported in this. I know that doesn't help younger people.
Just a point to note on that as well, the passes don't fully fund the extra expense of a boat, especially chartered on a Wednesday. It's only a proportion of that money, so they still end up spending their own money.
Let me clarify that. I think we pay for full cost in the local authority. I don't know whether, are you sure?
Absolutely, we had an instance very recently.
Can you bring that to the team separately? Thank you.
Yep.
I think this is an issue. Scrutiny is the best place for this one.
I think on the wider point that Paul raised around the sort of whole holistic transport, I know that the Chairman of Council is working very hard to bring key players together. So I think there's obviously a conversation that needs to be had with your group looking at medical transport and perhaps with sort of a more overarching position of where we are with transport and where we're going in the future. So that's perhaps something which can take place outside the meeting.
Yeah, I'll just comment on that, Chairman. Thank you. The Transport Board has now been reinvigorated at long last. Although I was unable to secure the board's expansion to include every stakeholder, we have got a position now where a new stakeholder group is being formed, which will include Healthwatch, of course. That stakeholder group will be considering a whole raft of options which the board is putting together at the moment in a stakeholder group meeting in January. That will be followed by a public meeting on transport in February. So things are moving, fortunately, quite rapidly on the transport front now, which will hugely impact the requirements of our community. Thank you.
Thank you. There are 6 recommendations on this report, but we haven't touched on the narrative around 2 of them yet, which is around the winter pressures money and disabled facilities grant. Did you just want to say anything about those before we...
Winter pressures funding, which was recently announced, obviously, it's done on a relative needs formula, so we end up with a grand sum of £12,000. The sensible thing to do is to put it against commission services. We haven't got capacity or time to commission brand new projects in order to deliver it this winter. So the intermediate care arena seems to me, based on historic evidence, to be the most sensible place to put this, where we know that we see more wobbles in the winter, as with all other local authority areas. So that could fund 2 to 3 intermediate care beds. So I think that's an appropriate use of the funding. And then disabled facilities grant, as you know, we get an allocation each year that comes directly to the local authority. And we do promote that with all eligible residents, and that includes children. And we've got a pipeline project underway. We still have some underspend from last year, but there's been some really interesting proposals coming forward from colleagues in health about setting up a kind of community equipment store, which would be of benefit to all residents. And we're not quite sure how we're going to do this. We don't know, we need to buy a shed, but I just wanted to kind of sound you out, because even though it's not strictly speaking going directly into someone's home, the feedback that we get from people who live on the islands, and I'm sure Dr. Picken will agree with me, is that just bits and pieces could make all the difference. And it's not easy to get those bits and pieces when you live on an island. So that's something we're looking at doing. It doesn't use all the allocation. You are allowed to use disabled facilities grant to support social capital projects. And actually the government's doing a huge consultation on DFG in the future anyway. I think it's a scheme that's going to need to evolve over time.
Thank you very much. Any final comments before we look at the recommendations for approval? Okay. So does anyone, I was going to take them all on block. Are we happy to move forward with each of the recommendations, A to F? There doesn't seem to be any objections at this end. So I think that can be assumed that that's carried.
NHS sides, are they happy?
Anyone outside of the room on St Mary's got any comments about the recommendations, or are you supportive of those?
Yeah, I'm supportive.
Jolly good. Thank you very much indeed for that. I think we have one final paper which Bob put together. It seems more of a housekeeping type document to me. Bob is in Bermuda, I'm led to believe, at this point in time.
That's not on.
So I know. Whether we bring it to the next meeting, I don't know if we need to go through it in detail, but it seems to me to be talked about a more collaborative approach to setting dates for meetings rather than be decided by council. Perhaps we ask members of the board when suits them and to increase participation. Reviewing the terms of reference, I think, is a practical, straightforward and sensible, non-contentious issue. And again, it's using the chair and vice chair to link with some of the decision-making processes that carry on. So I don't know if anyone's got any objections to those issues set out in the paper. Any comments?
I think that it'd be really, really good to consider a model a bit like we have with One Vision, where we have some representation at the Health and Wellbeing Board in Cornwall, because then we get to see that bigger debate, but also retain our local flavour. So as you know, with One Vision, we go to the meetings in Cornwall, we're right there at the heart of it all, and then that all flows through back into Children's Trust Board and up again. And I think there's a lot to be said for that. And I'm sorry we lost Adam Painter, but it was great to see him. And I think the thing is, we are working as a system. We can't on Scilly do everything. We need as many friends as we can in Cornwall to kind of also keep an eye on things for the Isles of Scilly. So I think it'd be really worth exploring more joint working with the Cornwall and Isles of Scilly Health and Wellbeing Board, whilst retaining that oversight here. And we are modelling that really well. And I don't know what you think, Chairman, about your experience of One Vision so far, but I think it's having huge benefits to the islands. And we're really right in there in the debates, aren't we?
We are. Yes.
Yeah, and we've got lots to offer. And that's the thing we always forget. We've got not just lots that we want to take, we've got loads to say. And advice on developing family hubs and developing emotional resilience models. So that would be something I'd really like to explore over the next year.
Can I just chip in there as well? In terms of, I can't speak on behalf of Adam, but I know we have discussed informally about close relationship between the two health and wellbeing boards, and I think we would really welcome that. Actually, I think that's a really good proposal. And linked to that, after sort of agreeing to the concept of joint JSNA and joint health and wellbeing strategy, I think that will facilitate that working much better if there is closer links. And also, if possible, I don't know how much of this is around, with Bob not being here, it's difficult to say, but how much of this paper is around agenda setting for the future. But we will certainly need to bring something back on any new health and wellbeing strategy that we're in the process of developing, to give you the opportunity to comment as time goes on.
Thank you for that input. Any further comments around that topic? There doesn't seem to be anything from this room, but again, we're sort of talking about the medium term, aren't we? We're not sort of looking to make any formal decision by early new year. So I think if we give ourselves a year to explore all the different opportunities, pros and cons, that will give us a good basis for making a long-term decision. So I think with that, it concludes our meeting this morning. We've gone through quite a lot at quite a rate. Thank you for all those who've participated either verbally or behind the scenes to bring papers to the meeting. I think we can declare the meeting closed at that point.
Thank you.
Thank you very much.
Bye.